I've gotten this a lot where people would just message you, oh, you just give me an idea of what to eat. Now, everybody, the food that you're supposed to eat per day is supposed to be calculated per your body weight. Just like every drug is calculated per a person's body weight. Hello everyone, welcome back to my channel. If you're new here, hello and welcome to my channel. Thanks for clicking. Or if you're a returning subscriber, thank you so much for the love and the support so far. Please, today don't mind the makeup. We are not doing normal things here today. So I've been seeing this Fulani wrap, okay, and I'm somebody who loves to wrap my hair a lot. So today I'm going to be doing that. This is my first time, so let's see how I do it. Okay, so I'm using my cardboard and then the cloth. Yeah, we are going all Ghana. So I'm going to wrap it in the middle. And then this is the simplest, so let's see if it's actually true. So I'm wrapping it. I'll wrap it until it's not enough for my head. So I'll wrap until I get to that. So I think at this point it's okay. So I'm going to go ahead and tie it to my head. Guys, let me know if it looks nice on me, okay? So you guys, let me know how I did, okay? So that's my Fulani hair for today. I don't know how I'm looking right now, but I believe it's good. So today I've had a lot of people asking me about exactly what dietitians do. So today I'm going to be taking my time and going into details what we do. Okay, so basically dietitians are professionals who are trained to help patients with their dietary needs. So we have a lot of, or should I say, we have different cases, different medical cases, surgical cases in the hospital, right? So each person has like a unique need when it comes to dietary needs. So when I first see a patient, what I'm going to do is I'm going to first make sure I do my assessment before I do my intervention. So basically dietitians have like a procedure that they use, which is called the ADIME format. ADIME, ADIME, right? Basically the meaning of that ADIME is assessment, diagnosis, intervention, then evaluation. So basically today I'm going to be using a case study. Okay, so let's read the case study. So Mr. B is an 84 years old man who has been admitted to the hospital on account of a left ventricular heart failure, a diabetic foot ulcer, dysphagia, and then bronchopneumonia. When this patient is referred to me, the first thing I do is that I go to see the patient, then I do my assessment. Okay, a lot of people just reach out to you and they expect you to just, write a plan for them. That is not actually what we do. First, you have to assess every patient like the way a doctor would see a patient before he prescribes medications. He's not just going to see the patient and say, oh, take amoxiclav, take this. No, he first has to do his assessment. So the same thing applies to dietitians, okay, and I believe all other health workers. This patient, an 84 years old man, who has been admitted on account of a diabetic foot ulcer, a ventricular, which is like a heart failure, also bronchopneumonia and dysphagia. So first I go to see this patient, then I do my assessment, which is the first protocol. Now for the assessment, I'm checking his weight, I'm checking his height, I'm going to check other factors. So in checking all this, I'll make sure that I calculate his BMI, which is his body mass index, to see whether he's overweight, underweight. That will help me to know whether this man is eating well. Those are like some assessments that helps you to diagnose the patients. Yes, the doctor has his diagnosis. His diagnosis is the ventricular failure, the dysphagia and all that, but there are nutritional diagnoses that I also have to make sure that I'm tackling what the problem is. Please, do you understand me? Yes, we are in class. Amen. So next thing is that in my assessment, I'm going to look at some of his lab results. So they've done electrolytes, they've done the liver function test, they've done kidney function test. I'm going to look at all those things to see whether all these parameters are in the right levels. Okay, so that way it will help me know exactly what is going on. So when I check and I realize that, oh, his sodium is very high, that will give me an idea of what kind of food to give this person. Okay, so fast forward, I also have to do like physical assessments. So we call those ones the nutrition focused physical findings. In other words, it's also called clinical signs and symptoms. So that way I'm looking at whether he has edema, whether he has there's dehydration, whether there's pallor, all those things. So I'm going to look at all these things before I even get to the point where I want to even prescribe food, or before I'm going to draw a plan. So after that, I'm going to look at, okay, now I've seen that he has he has dysphagia. So what level is that? The dysphagia has different levels or different phases. So depending on the phase, that is what will help me modify the diet that I'm going to give him. So that way I have an idea of what to do. So when it gets to the point of diagnosis, based on all these assessments that I have done, it's going to help me know what diagnosis to make. Okay, so I've discovered that he has dysphagia, and also this is what is causing him not to eat well. So in a day he's supposed to eat around, let's say 1,800 calories, but he's not able to meet that because of the dysphagia. So that way I'm going to make my diagnosis. So this way I make my diagnosis, then finally I can do my intervention. And even before that, I have to ask maybe the caregiver, what and what have you been giving this person? How is he able to eat the food? When you give him one bowl of banku, is he able to take off, or he's able to take small? All these things will give me an idea of what intervention to make, so that I don't go doing other things or saying, oh, eat this, and then at the end of the day we are not achieving anything, because I'm setting goals. By the end of the day, I want to meet this, I want to do that. So these are the things that would help me to know. So finally, when it gets to my intervention, I'm now using my assessments, my diagnosis to inform my decision of doing, okay, I'm doing a DASH diet, or I'm doing a Mediterranean diet, or I'm doing a high fiber diet, or I'm doing a low protein diet, or I'm doing a high protein diet. All these things come to play. So when you contact a dietitian, or when you contact me, don't just expect me to give you a diet plan. That is not what I'm supposed to do. I've been trained, or every dietitian has been trained to first assess you. After the assessments, they do their diagnosis, and after the diagnosis, then they give you a very well tailored intervention which will help you manage your condition. I've gotten this a lot, where people would just message you, oh, you just give me an idea of what to eat. Now everybody, the food that you are supposed to eat per day is supposed to be calculated per your body weight. Just like every drug is calculated per a person's body weight. If you are a child, your age also comes to play. If you are an adult, your age also comes to play. All these things are factored in, even when it comes to food. So when you contact a dietitian, you don't just expect her to start giving you a list of foods that you should eat. Oh, Debia, you are pregnant, so these are the foods you are supposed to eat. Yes, they can give you that general thing, but that plan has to be tailored to you. Maybe you are pregnant but your HB is low, so that way the dietitian, after doing her assessment, will take her time to say, okay, you have your HB is low, so now I think that you should be eating this and this and this and that. Oh, I've seen that your sugar level is going up, so now for this reason you're supposed to eat this and that. That way your plan is tailored to you. But if you just approach the person and you say, oh, give me a plan, you just write something for me so that I'll have a plan to follow, it doesn't work like that. So I just wanted to take my time and then clear the air when it comes to what exactly dietitians do, and when you contact a dietitian, what you should be expecting. You should be expecting that this person does her assessment. Even when it is online, okay, you contact the person and it's online, the person can still request for some labs for you, where you go and do the labs in any lab that is available, and then you bring the results, they look at the results, and then they tailor the plan towards you to meet your needs, whereby they are not giving somebody who is 60 kgs diet plan to another person. No, maybe you are overweight, or you are underweight, or you are obese class 1, class 2, class 3. You all require different things. So I just wanted to take my time and clear the air when it comes to that. So please, if you've made it this far, please follow, like, and leave your comments. If there's any question for me, please contact me. Okay, thank you so much. I also give one-on-one consultation, dietary consultation. So if you feel like you want to talk to a dietitian for any reason at all, any health condition, any surgical condition, anything, please feel free to contact me. I'll be more than willing to attend to you. Thank you so much for watching. Love you. Bye.